This is a picture of a patient presenting with heart failure. In this picture, we have a patient presenting with nephrotic syndrome. Over here, we've got kwashiorkor, and in this image, we have liver cirrhosis. So the thing that is common amongst all these pictures of these conditions is that these patients are presenting with fluid overload or with edema. So in this video, I kind of want to tackle how this edema is happening, the principle behind why these patients are presenting with fluid overload. So whether you're a medical practitioner or you're a medical student, for you to understand edema, you need to understand fluid dynamics happening in the body. When you have this understanding, it would be easy for you to understand why patients will present overloaded. Okay, so I like to think of the two forces that are acting on each other, acting on some sort of a seesaw. We've got force A on this side and force B on this side. And let's just say force A is exerting 5 newtons and force B is also exerting 5 newtons. And as long as these two forces are equal, the seesaw will remain perfectly balanced, as all things should be. Shout out to Thanos. Okay, so think about it in a similar manner. This is a blood vessel, and we're going to have force A and we're going to have force B. So remember, we said force A is about 5 newtons and force B is about 5 newtons. And as long as these two forces are equally balanced, fluids, in this case blood, will keep on flowing within the blood vessels. Anytime that there's a mismatch between these two forces, say force B was 2 newtons, what we end up seeing is that we'll have fluids seeping out into the third space and leading to what is known as edema. So coming back to our seesaw, we had force A and we had force B. So these two forces, let's call force A hydrostatic pressure and let's call force B oncotic pressure. So our hydrostatic pressure is mainly regulated by our blood pressure, or basically the amount of fluids in a given compartment, whilst hydrostatic pressure is going to be regulated by proteins, and the protein specifically we're interested in is going to be albumin. So you can easily see that as long as there's a mismatch between the hydrostatic pressure and the oncotic pressure, this seesaw will not be perfectly balanced. And so fluids can then begin to seep out into the third space. Again, we've got hydrostatic pressure and we've got oncotic pressure. If these two forces are not balanced, will then lead to the patient having fluid overload or edema in this case. So let's think of a condition in which we have, let's just start with the easy one, a reduction in oncotic pressure. The commonest one is going to be nephrotic syndrome. So in nephrotic syndrome, we know that these patients are losing proteins in the urine. There's proteinuria, and the protein amongst the different proteins that are lost, the one that will be mainly important for this fluid dynamics is going to be albumin, which again is lost in urine. So remember, we said hydrostatic pressure. In this case, we're saying it's 5 newtons. And oncotic pressure, we also said it's 5 newtons, as in this example. So a patient comes in with nephrotic syndrome and they've been losing out proteins in urine. They've had proteinuria. Give or take this time, let's say that the amount of oncotic pressure is 2 newtons. I'm just using these numbers as an illustration, no need of remembering them. So what we end up having is the seesaw will look something like this. Hydrostatic pressure, which we said was 5 newtons, and oncotic pressure this time, which is looking like 2 newtons. So because of this mismatch that we have, we're seeing that hydrostatic pressure, in as much as it hasn't increased at all, the force that is opposing it, the oncotic pressure, is not sufficient to oppose it. So if this was a blood vessel, again, we have hydrostatic pressure, we said it's 5 newtons, and we are having oncotic pressure, this time we're saying it's 2 newtons. So because there's a mismatch in these two opposing forces, fluids can then begin to seep out into the third space. And these patients are going to present with what is known as edema. And that's what's basically happening. So this principle will be the same in a patient who has, say, kwashiorkor, who has lupus nephritis, which is basically a nephritic type of syndrome. Whilst when we're looking at conditions like heart failure and let's say liver cirrhosis, it's a little bit different. So starting with heart failure, Remember again, hydrostatic pressure, we said, is mainly regulated by the blood pressure and the fluids in a given compartment. So in heart failure, the heart is failing, go figure. So let's say this is the lower limb, we have the foot and the leg, and we have a blood vessel. Remember that the heart is failing, so blood is not being properly circulated, going back to the heart and being pumped through all parts of the body. So what we start having is some sort of accumulation of blood in this given compartments. And again, hydrostatic pressure is regulated by what? The blood pressure and the fluids in a given compartment. So by virtue of this, we have increased the pressure or the fluids in this given compartment. And what ends up happening is we are raising the hydrostatic pressure. So coming back to the way this was, this time we have increased the hydrostatic pressure, and this time, say, oncotic pressure has just remained the same. So from it being, so we said this was 5 newtons, from hydrostatic pressure being 5 newtons, say give or take, it's now 7 newtons. So these 5 newtons cannot oppose the 7 newtons. And so what ends up happening is fluids will begin to seep out into the third space, leading to what is known as edema. And so this is why patients with heart failure are at risk of having fluid overload, the bilateral pedoedema, or even in the lungs with the pulmonary edema. The principle remains the same. Hydrostatic pressure has increased and oncotic pressure is almost nearly the same. Of course, that's not to say that heart failure can't lead to some sort of liver issues or kidney issues, and then the oncotic pressure is also affected. But in a nutshell, this is what's happening. For your liver cirrhosis, it's just basically increasing the portal pressure. So basically, just think of it as, again, the blood pressure in this case. We said hydrostatic pressure is a product of the blood pressure. In this case, for liver cirrhosis, we are increasing the portal pressure. And so we've technically increased the hydrostatic pressure, which will not be easy to overcome with oncotic pressure. And at the same time, albumin is produced by the liver. And if the liver is jacked up, well, we're going to see a reduction in albumin and an increase in hydrostatic pressure, leading to the presentation in the picture. So I believe repetition is the teacher of all masters. We're saying fluid dynamics in the body is regulated by 2 forces, hydrostatic pressure and oncotic pressure. A mismatch between these 2 forces is going to lead to fluid overload, or what is known as edema. Alright, thanks for watching this video. Peace.